Hello, our beloved viewers. This is me, Isaac, and
it's me, Daniel. Happy to have you watching us from Tribal Roots Studios. And again, it's our health talk, and we have something for you even today.
Yeah, Daniel is our health coordinator and head of our health department. So Daniel, today you brought a very interesting topic.
Yes, sir.
And I was there and I felt like, we should really talk about this, and personally I need to know more. So I will be pinpointing a bit here and there, asking you a few questions. You tell me more about this, as our viewers also learn from this.
Okay.
Yeah. So today you brought this good, wonderful health topic. Non-communicable diseases. Yeah. So to a layman, what's that?
Non-communicable diseases, I can say these are diseases that first of all are due to pathological alterations in the body that lead to impairments. Basically, these are diseases that are not due to infectious causes, or you cannot point at one cause and say that maybe just like malaria, you can say that there is a parasite that is responsible for someone to have malaria. But usually non-communicable diseases, we have a lot of factors that come into play that lead to alterations in the body and have the body obtains those kind of impairments. And so when we are talking about non-communicable diseases, we look at one. Are there any pathological alterations in the body of an individual? Two, does it have the ability to cause residual disability? You get me? And also most of the times they are also referred to as chronic. They are chronic diseases, and you realize that these are long-term illnesses. And basically I can say that those are non-communicable diseases.
Just to cut you short,
yes, sir.
I want this to be very educative to someone who is watching outside there, so that they don't miss a point. You know, when you were defining, you talked about pathological alterations.
Yes, sir.
Yeah, what is that?
Talking about pathological alterations, you realize that there is a way, I will put it in a layman's language for all of us to understand. There is a way your body is supposed to function normally. And if for any reason your body is deviated from that normal functioning to another way which the body was not designed to function, that can result into a disease. And in this case, those kind of diseases, we are calling them non-communicable diseases.
Okay. Yeah, so talking about this, what are some of these diseases we are talking about here? Yes,
very good question. Some of these diseases, there are so many. We have so many non-communicable diseases. But as according to the WHO, we have the priorities, the ones that are common globally. Also in our region as Africa, we have some of these. We have what we call the cardiovascular diseases, and these are the ones that affect, in our body we have what we call the cardiovascular system. And when you're considering that, you consider the heart and the blood vessels. And so the diseases that affect the cardiovascular system are the ones we call the cardiovascular diseases. And some of them, the common ones that are affecting us, that are really having a high burden of mortality and morbidity. Globally and in Africa, we have the chronic heart diseases. We have the hypertensive heart diseases. We have we have a lot of conditions concerning that, but majorly we can talk about those in the cardiovascular. Then we have the chronic lung diseases, and you realize that we have a lot of things that we are exposed to that lead us into that. We also have cancers. It's a really big burden and it's increasing every other day. Globally, we also have diabetes. Diabetes is also having a rise. It's on a rise in our population today. So basically, according to the WHO, these are the things, those are the diseases that's where our focus should be, because according to the statistics, they are on the rise. And you realize that when you look at the causes and the risk factors of these the above mentioned diseases, most of them are inevitable. These are things that we interact with daily in our deity, in our way of life, at our workplaces, where we go for schooling. And so that's why it's very important for us to be discussing these particular ones at this hour.
Okay. You talked about the risk factors. Can you go ahead and tell us the risk factors and the people who are at risk, more at risk of?
Who are at risk?
Yeah.
Thank you so much. As we say that they are priority diseases. Also, when we come to risk factors, there are priority risk factors because they have been identified as some of those things that are common in people who are being found to be suffering from non-communicable diseases. And talking about those risk factors, we have the common ones. Now we have tobacco smoking. Tobacco smoking is really a problem concerning the non-communicable diseases. Research has it that because there is a program, there is a survey program that was started in the year 2002 by WHO, and its intention was to dig deep with statistical data and scientific evidence concerning the non-communicable diseases. And they in Africa, I think over 33 countries have been able to carry out this survey. And according to that survey, it's called stepwise survey. According to stepwise survey, it has been identified that actually in when you interact with young people or people who are smoking, you realize that they started smoking in their teenage period of life, 18 to 26. So before we used to know that these non-communicable diseases are actually conditions that are common in elderly people, people who are over 70 years and all that. But you realize that now when you look at the statistics, actually these conditions are being more found. Half of the people suffering, the victims, are teenagers, are young people, or even young adults. So why I brought that is because it's an evidence that actually tobacco smoking which is being begun in this young age, has an influence or has the effect on the developing of the non-communicable diseases. So that's why it's important for us as tribal roots also to come up with this kind of program, because when you look at tobacco smoking, it's common, or this habit is being developed in the early age, and that's when we come in as young people to sensitize our fellow young people to know that tobacco smoking is one of the risk factors and things that can predispose you to non-communicable diseases, which can impair your life and the expectations of the society and your family, and even your own expectations in life. So tobacco smoking is one of them. Also, we can talk about diet. The things, the kind of foods that involved in our diet. What do we feed on?
Junk,
yes. Talk about a lot of sugary foods, imbalances of content in the food. Those are kind of things that can predispose us to non-communicable diseases, cancers, diabetes, talk about hypertension. All those are things, they are conditions that can be brought about due to our nutrition. Another thing I can talk about is physical inactivity. You realize that due to our schedules, design, and most of the people don't really pay attention, especially here in Africa, don't pay so much attention on the importance of doing physical exercise. Yet it's very, very important in the curbing of these non-communicable diseases. So it has been found out on research that actually people who are found with most of the non-communicable diseases, especially the cardiovascular diseases and diabetes, are such kind of people who have lived a life of physical inactivity. The kind of work they do doesn't even give them time to even exercise their own body, which can actually help them regulate their weight, regulate the sugar levels in their bodies, and at the end of the day, all these factors work together to come up with things like, of course, the diabetes and all those diseases we've mentioned before. Basically, also what I can talk about is alcohol abuse. Yes, you realize that when you look at alcohol, it's a substance that can affect almost every organ of the body, but mostly it has been identified in people who have liver disease. Liver disease is a leading cause in liver disease, and so those are some of the few risk factors I can mention. And also people, I can talk about the intermediate risk factors, things like obesity, call it overweight, things like someone being found with scientifically we can call it hyperlipidemia, or someone being found with a lot of, for someone out there to understand me, fats in your body than normal. Basically those. So yes.
So you discover that in our societies, if you meet with especially the elderly people,
yes,
you discover that out of 10, either 5 to 6 are suffering from hypertension and other kind, but especially here in our communities, hypertension is very common among the cardiovascular diseases.
Yes.
So how statistically, how are we? So statistically, how are we standing? Like, how serious is this? Like, how is it affecting us? Because given other diseases and all that.
Okay. Okay, then I'll talk about it in general. Though you mentioned the elderly, but I'll first talk about it in the general. If I'm to remember very well, in the year 2005, the WHO came up with a projection of that in by 2030 we shall have an increase of 15% in deaths as a result of non-communicable diseases. That was to mean that globally we shall have around 44 million deaths as a result of non-communicable diseases. And that's a serious burden if you have to look at it. And that would mean that the death as a result of non-communicable diseases are to rise beyond the death as a result of communicable diseases, the usual diseases that a layman out there is used to talk about in Africa here: malaria, TB. Talk about those, all of those combined together. The non-communicable diseases will actually cause more death than those. And also in Africa specifically, they projected and it was predicted that by that time we shall be having 4 million deaths as a result of non-communicable diseases, which is really a high, rate of death. So that's why we come in. That's why it's so important for us to come in with these kind of talks, because these are actually, there are misconceptions around non-communicable diseases that have been around for a while. And one of the misconceptions is that actually these non-communicable diseases are common in only the elderly people, which is no longer the case. Another misconception that these are diseases, when you make a study, actually mostly in Africa here, you realize that most people actually think that these are diseases that are common in rich people, which is not the case. Actually, on the contrary, these are diseases that have been found to be a burden in the middle income and the developing countries. So that's why it's important for us to come up with these kind of sensitations, so that we as Africa and the globe, we don't lead into that direction. And also another misconception is that actually non-communicable diseases are very expensive and are difficult to control. Actually, when you look at it in the regard of the risk factors and the causes of non-communicable diseases, you realize that it's actually not costly and it's inexpensive. Because the fact is that when these diseases are identified in their early stages, as we shall go in the details, they are preventable and curable. So that's why it's very, very important for us to be talking about this topic at this hour. Yes, sir.
So what are some of the complications that result out of these non-communicable diseases?
Oh, thank you so much. As as we talked before, one of the results of the non-communicable diseases, they are chronic illnesses. So these are kind of illnesses someone will live with for almost their entire life. So it's really for someone who has ever been sick, it's really a place of discomfort. Only that feeling of having a sickness in your body, it's already a complication, because you will be required to be on long-term therapies, which are really bothering and a challenge to someone's life. Most of these kind of diseases result in physical disability. So for someone who has been earning from hand to mouth, imagine someone who is actually, which is I would say this applies to anyone working, and you get a kind of disability on your body. This will be a complication on your economic status for someone who has a family there, for a young man who has dreams, to pursue, and then all of a sudden you develop a physical disability on your body. Like in diabetes, we have what we call diabetic neuropathy, where someone can actually end up losing their foot, losing their limbs, and any other part of their body. We have the cancers, the chemotherapies, and all that. And also we've had premature mortality due to non-communicable diseases. Cut someone's life short. Depression, and a lot of complications that can be as a result of non-communicable diseases.
So, Mr. Daniel, how do we go about these non-communicable diseases?
Yes, Mr. Isaac, what I can say, because now they are tagged incurable. So these are they are chronic illnesses. So the best solution to this is prevention. And when we talk about prevention, we talk about things like health promotion. Health promotion, where we have an intention of equipping and sensitizing basically our community on the ways which can be a safe zone for us from these non-communicable diseases. How do you take your life? What are those even certain things we take minor that are done in our daily lives for us to avoid the development of these non-communicable diseases? What are the things that we should include in our diet? What are the things that we should actually minimize in our diet? What are those kind of activities that can help us reduce the body weight, keep our bodies fit? What are these kind of habits that should be eliminated? Things like tobacco smoking, regulating alcohol use in the community. So you realize that it all comes back to prevention, because once the body is altered in a certain way, sometimes it's very hard to reverse it. Sometimes to avoid going to a situation where you have to be on long-term therapy and drugs for you to survive, we better do prevention. And we do that just like what we are doing now, sensitizing the community, equipping them with the necessary information, encouraging the discontinuation of certain habits in the community. And in that way, we are able to go about this challenge of non-communicable diseases. Yes, sir.
Thank you very much, Mr. Daniel. I think to all the viewers who have been listening, you've heard you have to now improve on your diet, know what you should eat, know what you input in can affect your body. What you do, the activities you do can also affect your health. So as we heard from Mr. Daniel, let's work on our health and That way we shall be able to live in a healthy way. Stop eating, picking up things. When you're traveling, you meet a lot of things on the way. You want to eat this, eat that, eat this. Have time to eat quality meals and a balanced diet, and have a good mind. I think having a good mindset is also
very
a good,
important.
it's
very,
a good
very
factor.
important. Actually, in the coming days, we shall have to discuss about stress. Stress on its own. You realize it's now a big challenge. People are dealing with stress and are dealing with consequences even without knowing. So, yeah, I think.
Yeah, and they are falling into depression and all. Yeah. Okay, that's nice. That's nice.
Yeah.
So to all our viewers, don't miss out on any of our episodes, and make sure you subscribe, comment, like, share the video, tell a friend about this. This information is not for you alone to keep. If you find it useful, you can share it with your friends, your family. Let them know what to do, and that way we shall improve our communities. Yeah. So I think we meet again next week.
We'll meet again next week.
Yeah.
Thank you.
God bless you.